Yes, good morning, good evening, good afternoon, wherever in the world you might be. So let me start right away. Mr. Chairman, the President of the Young Pharmacists Group in Sierra Leone and your esteemed executive, I want to first of all start by thanking you very much for the opportunity that you have accorded me to serve as keynote speaker in this occasion. Distinguished colleagues, pharmacy professionals, young interns as well as students, well-wishers of our noble pharmacy profession, ladies and gentlemen, a very good morning to you from where I am currently. And may I respectfully suggest that all due protocols have been observed. It is first of all a great honor and a privilege to join you here today, not only in my official capacity as Chief Pharmacist and Director of Pharmaceutical Services in the Ministry of Health, but also professionally as a senior pharmacist colleague. I would like to describe this event as an epoch-making one, an innovative one at that, a virtual summit, an annual general meeting of the Young Pharmacists Group in Sierra Leone. Allow me in the first instance to congratulate the leadership of the group for selecting a theme that is not only timely, but profoundly relevant to the future of our profession, and indeed to the future of our nation. 300 days of activism against maternal and child death, empowering young pharmacists to save lives. This, in my view, is more than just the theme of a General Assembly. I would argue that this is a national assignment, a professional obligation, and a moral responsibility. And yes, today, it is our collective call to action. Permit me to begin with a very simple story. During one of my several impromptu visits to health facilities, I had the unique chance to speak with a young midwife. She looked at me in the eye, not with any sense of frustration, but quiet disappointment. And she said to me, "Mr. Chief Pharmacist, we as midwives know what to do. We have been trained to do this. But frustratingly, sometimes the medicines that we need to do our job are simply not there." I have to confess, it is statements like this that continue to remain our Achilles heel in the public sector. And we keep being reminded about it every single day. It should keep us awake at night. For me, it really does. Think about it for a moment. Imagine standing beside a mother who is bleeding after childbirth. You very well know that oxytocin or carbitocin can save her life. You know exactly how to administer this medication, as a matter of fact. You know she can survive if she has access to it. But when the refrigerator or cupboard in your store is opened, there is nothing inside there. At this moment, the problem is no longer clinical in my view. The problem is purely pharmaceutical in nature and scope. Somewhere along the supply chain, something terribly happened. Maybe our forecasting methods failed us. Maybe procurement was delayed. Maybe distribution broke down. Stock management was inadequate. Maybe the data that we have relied on all along is inaccurate. That mother standing right before us bears the full consequences of the failures that have occurred hundreds of kilometers away from her comfort zone, but right under our watch. This is precisely the reason why pharmacists and pharmacy professionals matter. Pharmacy and pharmacy professionals matter not simply because we dispense medicines, but actually because we build the systems that ensure medicines are there when lives absolutely depend upon them. But what is the reality that is confronting us today? It is that every maternal death leaves behind a grieving family. Every child lost to a preventable illness represents an unrealized potential. Every one of these deaths should challenge us because many of them are preventable. Sometimes the difference between life and death is not even sophisticated technology. Sometimes it is simply the availability of a medicine that costs only a few leones. So sometimes it is an antibiotic that the patient needs. Maybe it is magnesium sulfate or oxytocin or heat-stable carbetocin. Maybe it is even a simple oral rehydration salt. In some cases, it is even a vaccine that reached the community on time because someone ensured that the cold chain never failed. So, ladies and gentlemen, medicines do not save lives simply because they exist. Medicines save lives because, one, they are available, two, they are accessible, three, they are of assured quality, four, they're properly stored, five, they are rationally prescribed, and six, they are correctly used. So our reality is that the entire supply chain is really our professional responsibility. Picture a woman living in one of our rural communities. Before sunrise, she hurriedly straps her sick child onto her back. She walks nearly 2 hours to the nearest PHU. Come to find out, that child has pneumonia. The clinician makes the correct diagnosis. The prescription is well and accurately written. Everything has gone exactly as it should. Now imagine two different scenarios. In the first scenario, the pharmacist has ensured that the essential antibiotics are available. The child receives treatment. The fever subsides. The child survives. And that child gets to celebrate another birthday. In the second instance, unfortunately, the shelves in the pharmacy are empty. The mother returns home with only hope to lean on. That child deteriorates in health. And the worst happens, the child dies. So in these two scenarios, one family is celebrating and the other family is mourning, unfortunately. Now the difference between these stories may have been determined months earlier than the event that just happened. By forecasting, accurately or otherwise, by sound or unsound procurement, by effective or ineffective warehouse and inventory management practices, by the timely or the delayed distribution of commodities, by efficient or inefficient post-distribution surveillance of our commodities, by the rational or irrational use of medicines, and you can go on and on. Ladies and gentlemen, this is the unseen power of pharmaceutical systems. And so the question becomes, why does these 300 days of activism matter at all? As you may already be aware, the government of Sierra Leone embarked on this initiative out of a simple premise. Business as usual is no longer acceptable. Reducing maternal and child mortality and ensuring that we have zero dose children requires extraordinary commitment from every cadre of the health workforce. This initiative is not simply about improving service delivery for the sake of it. It is about strengthening the systems that make quality healthcare possible. It is about impact. Pharmacists occupy a unique position within that system. We as pharmacists ensure uninterrupted access to essential medicines. We safeguard the quality of medicines. We promote the rational use of medicines. We combat antimicrobial resistance. We strengthen procurement and supply chain management. We support digital health systems. We provide medicines information. We protect patients. Listen, I am bullish about this. Without a resilient pharmaceutical system, there can be no resilient healthcare system. So as young pharmacists, you are not waiting for tomorrow. Many people still speak about young pharmacists as the future. Well, I beg to vehemently disagree with all due respect. You young pharmacists are already shaping healthcare today. Across Sierra Leone, you're managing hospital pharmacies. You're supervising medicine stores. You are supporting immunization campaigns. You are implementing digital logistics solutions. You are conducting pharmacovigilance. You are educating patients. You are leading in quality improvement initiatives. You are also expanding your roles into clinical services delivery. See what is going on at the ward rounds within Keynote Hospital and other hospitals around Freetown. And you are doing several other pharmacy-related services. So the future has already arrived. I really hope that the Ministry of Health has immense confidence in your generation, because I genuinely do. For me, it is a no-brainer. You bring energy, you bring innovation, you bring digital literacy, you bring fresh ideas. You have the courage to question old ways of doing things. And perhaps most importantly, you have a willingness to lead. Allow me to make another simple illustration. Imagine crossing a river in a canoe. Everyone in that canoe is paddling with determination. The doctor, the nurse, the laboratory scientist, the community health worker, you name them. But then beneath that canoe is a small hole. Slowly, water begins to seep into that canoe. Unless someone repairs that hole, everyone will eventually sink. Our pharmaceutical system is that unforeseen or unseen foundation. Without medicines, without reliable supply chains, without quality assurance, without pharmaceutical governance, the entire health system begins to take on water. Pharmacists must help to keep the canoe afloat. So we need to build resilient pharmaceutical systems. Resilience therefore means preparing today for tomorrow's challenges. It means ensuring that no crisis, whether it's a disease outbreak, whether it's an emergency, whether it's a supply chain disruption, prevents patients from accessing life-saving medications. Every young pharmacist should therefore commit to becoming a champion of 7 critical priorities. First, strengthen supply chain management. Every stock out that you prevent is a life that you have potentially saved. Second, let us be champions of rational medicines use, because every appropriate prescription can improve a patient outcome. Thirdly, let us embrace digital transformation, because the future belongs to pharmacists who can use data to drive and to inform decisions. Fourthly, let us protect the quality of medicines. Let me say this very clearly. Counterfeit, substandard, and falsified medicines have no place in our healthcare system. Number 5, let us become leaders in public health. Pharmacists belong wherever health decisions are being made. We have to be on the table. This is not a negotiable position. Sixth, we have to uphold professionalism and integrity. Trust remains our profession's greatest asset. And finally, let us commit to lifelong learning, because healthcare is evolving every day, so must we. So your legacy begins today. One day, another generation of pharmacists will stand exactly where you're standing today. They will inherit the systems that you built. So the question is really not whether you will leave a legacy. You certainly will. The relevant question actually is, what kind of legacy will that be? Will you be remembered as the generation of pharmacists that accepted medicine shortages as a norm? Or will you be remembered as the generation of pharmacists that modernized pharmaceutical services, that embraced digital innovation, that embraced the strengthening of supply chains? Would you be that generation that reduced maternal deaths through better access to essential medicines? Or would you be that generation that really changed Sierra Leone for the better and for good reason? Here's my challenge to every young pharmacist here. I want to leave you with really 3 simple but straightforward questions. Whenever you report for duty tomorrow, or on Monday for that matter, ask yourself these 3 questions. Whose life will be better because I came to work today? What one improvement can I make to strengthen my workplace this month, now? How will history remember me and my contribution to pharmacy in Sierra Leone? Listen, never underestimate your influence. One correctly entered stock record can prevent a stock out. One simple medicine counseling session can prevent a patient from being admitted to the hospital. One adverse drug reaction that you report can protect thousands of patients. Guess what? And I've had this cliche at the Ministry of Health before, and I loved it because it is so true. One pharmacist can transform a facility. One pharmacist can transform a district. One pharmacist can transform, or one district can transform a nation. So I really want to conclude with this African proverb. It says that the best time to plant a tree was 20 years ago. The second best time is today. The same is true of strengthening pharmaceutical systems, because 20 years ago, we failed on that opportunity. We have a perfect opportunity now to strengthen that system. That work cannot wait. The mothers cannot wait. The children cannot wait. The nation, Sierra Leone, cannot wait. So in these 300 days of activism, I want us to reaffirm our commitments to building strong pharmaceutical systems that are resilient, that are responsive, and that are patient-centered. Let us become pharmacists who do not just dispense medicines, but who are innovators, who are problem solvers, who are leaders, who are advocates, who are stewards of public trust. Ultimately, let us become the guardians of the health of the people of Sierra Leone. So to you, the Young Pharmacists group of Sierra Leone, here is my admonition to you. If you remain united in purpose, if you are unwavering in your professionalism and committed to excellence, I have every confidence that we will just be fine as a profession. And Sierra Leone will one day become the model of leadership in the pharmaceutical sector in our region. Young pharmacists, the future is not something that will happen to you. The future is something that you will build. So you go out and build it with courage. Go out and build it with integrity. Go out and build it with compassion. And above all, go out and save lives.